But just, yeah, there's definitely been some things I've been thinking about and utilizing lately, because I do have a background in manual therapy, but I tend to use it less and less. And I'm just trying to, still figure out like where it fits. And I've definitely, found some utility still, but it's different than it was, maybe when I first got into the education of manual therapy. And one of the things I've noticed is like the biggest change in my thought process is separating out the idea that I have to be changing something structurally, more to looking at it as it's just an addition to guiding someone's movement when they can't really do it without hands, right? Like they need the guide of somebody who knows the anatomy better than they do. And we as movement professionals know what we want to get out of our patients better than they understand what we're talking about a lot of times at first, right? So when there's that gap there of like, all right, I know what I want this person to do, they just can't do it yet, and I don't think there's going to be an exercise right now that can actually get them to even start to move in the direction that I want them to move. Mm-hmm. That's where the hands play a big role in directing them, guiding them, blocking, movement that you don't want. And that turns into all of the different techniques that we learn about, whether it's myofascial release, joint mobilizations, and it becomes, they're part of that process, right? Like you try to have them be as active as they can be in that process, but sometimes they just need to be guided so that their body starts to understand the direction that you're trying to get them to move. And I find this especially important when you're thinking about things around the rib cage, around the pelvis, where it's very subtle type of movement and everything else wants to move around it. So a lot of times the hands become almost more of a block than they do, like an actual, like adjuster or something like that.
Mm-hmm. Right. Almost like some ART moves are like that, where you're supporting one hand and you kind of get in there and nudge. Yeah, exactly.
Absolutely. Yeah. And I remember the first time I got ART and I learned about ART, it was very much the idea of like releasing a structure. But the more I've had it done to myself, the more I realized that like one of the real values is that it holds something in place while you're moving around it. So it's really just, it's like a hold. And then, you get all that kind of feeling that tissue is being ripped and, it's like separated, and it does feel like something is being, mechanically lengthened, but it's very much of it is it's also not allowing you to move where you would normally move from. So you actually are moving from where you are restricted, and then that improves pretty quickly. So I think there's, and it doesn't really matter oftentimes like how you describe the theory behind it. It's just like, do you get your change? But I do think that having the mentality of that it's more of like a movement guide for the things that people can't do instead of a specific anatomy or structural change guide can be very useful, especially when the research doesn't really point to, that it's backing up those structural claims.
Yeah, 100%. And I agree with you. I think the flavor I would put on it is that I like to use it as a way to allow someone to access movement they couldn't access before.
Right.
And so now
Absolutely.
you can do the quote unquote curative thing, to use that language.
Right.
Okay, I did this little hack. Now we can go do the therapeutic thing. Yeah, right. That's exactly to your point.
Yeah.
I think every now and then someone will ask me why we're doing the manual therapy. And that's where I have this moment. I have this coin toss in my head where, like, based on what the patient personality type is, then I got to do the arithmetic of like, do I give them the fascial answer or do I give them the smart ass answer? And, I tried to lean more smart ass, but, sometimes, the layers slide in the thing and, give them like the best theory available. until they trust me a little more.
Right.
But to your point, right? Yeah, that's not what the science is, right? The science is not pointing to, okay, well, the blood flow thing didn't pan out. Maybe now it's, there's something to do with the sliding filaments, or that didn't
Right.
go anywhere. Maybe it's
Yeah.
yeah, I think what I'm starting to lean more into is, and I've experimented with, maybe is the better way to phrase it, just telling people like, this is not working on the anatomical level. I want you to think about the neurological level. These are
Hmm.
nerve endings. I'm
Right.
changing your experience. Once it's changed, we can kind of create more movement. Some version of that.
Yeah.
I feel like that checks my own tick box of like, I want to, you know what I mean? While
Yeah.
also providing, all right, you answered their question and weren't just, coy about it.